Hi, my name is Barbara Murphy. I'm a medical oncologist. My area of clinical and research work is head and neck cancer. There are approximately 50,000 cases of head and neck cancer diagnosed annually within the United States. Unfortunately, most of the patients that we see present with locally advanced disease. That means they require multimodality therapy in order to attempt to cure their cancers. Head and neck cancer affects critical structures. Structures such as the tongue, the larynx, which is your airway, the upper esophagus and the pharynx, which allows you to swallow. It affects your face and your facial structures. It therefore affects all of the parts that make us human and allow us to communicate with other individuals and allow us to express and be ourselves. Unfortunately, treatment is also associated with a lot of side effects, and those side effects occur acutely during therapy, and they also persist for many patients long term. When patients have completed their therapy, they often are very different individuals than they were before they started their therapy. After treatment, patients have to renegotiate their identity, their social identity, their spiritual identity, and their emotional identity. This takes a great toll on them and also on the people they love. So there are a lot of stresses and strains on patients and their caregivers, and they have many needs. There are numerous unmet needs among the head and neck cancer patient population. First, some patients are uninsured, and because of that, they're unable to access care in a timely manner. If you can't get care, oftentimes you delay going to the doctor, and that means that when you do present to the doctor, your tumor is advanced and less likely to be cured, or even uncurable. Even with the best insurance, head and neck cancer costs patients a significant quantity of money and time. It also costs time and effort on the part of their caregivers. Some patients don't have the financial wherewithal to make sure that they do all of the things that are required to get through treatment to maximize their outcomes and maximize their chance for cure. Some of the problems include inability to get to their doctor's appointment because they don't have gas, inability to obtain prescriptions that will help them control their symptoms, inability to pay for nutritional supplements that can keep them from losing weight. They also need supplies for trach care, for feeding tube care, for wound care, for mouth care, and dental care. Unfortunately, many of these supplies are not paid for by insurance, and so the patients have to pay for them themselves. This puts a tremendous financial burden on patients, particularly if they are unable to work, and it puts a tremendous financial burden on the family and the caregivers. One of the important things to understand about head and neck cancer is that many cases are preventable. First, by preventing smoking. We need to keep our young people from starting smoking, and for those who smoke, we need to help them quit. We also need to make sure that people don't take up the habit of chewing tobacco. Another very important area of prevention is vaccination. Human papillomavirus, which is a cause of cervical cancer, is also a cause of oropharyngeal cancers. This is a type of head and neck cancer. The vaccine that is available for cervical cancer may also prevent cancers of the head and neck in the oral pharynx. It is therefore very important that we make sure our young teenagers are vaccinated, both boys and girls, so that we can prevent the development of cancers from this virus. Patients who go through head and neck cancer therapy oftentimes need radiation as a part of their treatment. Radiation therapy involves directing radiation beams specifically at a tumor in order to make sure that the tumor is targeted and not normal structures, normal tissues. A mask is fitted over the patient's head in order to immobilize them. That mask is fit very tightly over the face, the jaw, the eyes, and the head, and then the patient is bolted to the table so they can't move. This can cause just absolute tremendous stress for patients. You can imagine if you are bolted to a table, you have sores in your mouth, you have secretions that are blocking your airway, you have pain, and you're alone. And you have to stay that way for 10 or 15 minutes every day, Monday through Friday, for 7 weeks. Imagine what you would feel like. Many of our patients develop very severe anxiety related to their radiation, and sometimes that persists and they develop post-traumatic stress disorder. The mask becomes a symbol for patients. It's a symbol of what they've gone through in order to get a cure. It's a symbol of their loss of control. It's a symbol of their need to renegotiate their social identity. The mask becomes incredibly powerful. In Courage Unmasked, the mask that means so much to patients with regards to their cancer is transformed through art. And it no longer is a representation of the negative aspects of their cancer, but it can be transformed into something positive, something meaningful, something that can bring hope to future cancer patients and understanding to the people in the community who have never ever seen or heard of head and neck cancer. Some of the services that are required include speech and language pathology, to help them regain their ability to swallow food normally, speech therapists who can help teach them how to communicate once again, physical therapists who can help them regain jaw, neck, shoulder range of motion and improve posture deficits from their treatment, psychologists to help them deal with the anxiety, depression, and post-traumatic stress disorders that can result from treatment, nutritionists who can make sure that they get in enough calories and hydration in order to rebuild, and counselors and groups that help them rebuild who they are and rebuild their lives after their treatment is completed. I'd like to thank you for joining us here on this website. On behalf of the head and neck cancer patients, their caregivers, and all of the staff, we really appreciate the time that you've taken to listen to these stories. We'd also like to ask you if you could give to this very worthy cause. Head and neck cancer is a disease that has not been highlighted in the press and does not have great public awareness. We need to change that. In order to do that, we need your help. We would love a gift of your support, not only monetarily, but also if you could reach out to your friends and your families and get them involved as well. Thank you again.